dissimilarities between a male and female of a species which give them the different appearance. That means the characters which define the difference between a male and a female. Those characters are known as the sexual dimorphism. The difference appearance of male and female, the dissimilarities. These, what distinguishes these is known as nothing but the sexual dimorphism. So you know secondary sexual characters. At the onset of puberty, that is at 13 years of age or 12 years of age, the puberty starts, that is adolescence period, and ends at 19 years of age, right? So this period is also called as teenage. So in this period only the body develops secondary sexual characters, and secondary sexual characters are separate in boys and girls. You know what are those characters, right? So secondary sexual characters means features which highlight this sexual dimorphism. That means characteristics which separate the male and the female dissimilarities. Okay, those are the secondary sexual characters. Now since we have read about the female reproductive system, so what happens if the egg is not fertilized? We have read that the ovary releases ovum or egg once in 28 days and one ovary. So what happens to this egg? What happens if the egg is not fertilized? So you know that in female reproductive system the ovary releases the one egg once in 28 days, right? One from each side of ovary. One egg will be released from one side of the ovary. So if this egg is not fertilized with the male gametes or sperms, then what happens? So when the egg is not fertilized, it gets disintegrated. That means almost it becomes dead. And also in addition to that, the uterine wall also becomes disintegrated. So the eggs become disintegrated and the uterine wall lining also becomes disintegrated. And then the disintegrated egg along with the uterine wall lining comes out through the vagina in the form of blood. That is known as menstruation. So menstruation means the fragments of disintegrated tissues, the disintegrated egg and as well as the disintegrated uterine wall lining. So all these fragments along with the blood come outside of the body. So this is observed as bleeding from the vagina, which lasts for about 3 to 7 days. So menstruation means nothing but the fragments of the disintegrated unfertilized egg along with the lining of the uterine wall. All these come out as fragments, small pieces from the vagina, and this is observed as blood, and this is observed as bleeding from vagina, which lasts for 3 to 7 days. So one menstruation lasts for 3 to 7 days. So the bleeding which occurs for few days is known as the menstruation. So menstruation is nothing but the unfertilized egg which disintegrates, comes out with the blood, is observed as bleeding for 3 to 7 days, which is known as the menstrual cycle. So menstrual cycle means nothing but the series of so this bleeding is known as the menstruation, and menstrual cycle means the total series of events in the ovulation process. All the series of events together is known as the menstruation. Then what is menarche? Menarche is nothing but the onset of puberty. It occurs around 13 years of age. The onset of puberty is known as the menarche. The first period of the release of the first egg. When it occurs, it is known as the menarche. And then that means the egg matures and then it is released. And then what is menopause? Menopause is the stopping of release of these eggs. So it occurs around 40 to 45 years of age. The eggs stop to release from the ovary. So that is about the egg, where what happens to the egg when it is not fertilized. Next, there is something called reproductive health. So now since you have understood that how organisms reproduce and what all things come under reproductive system and what is the process of reproduction, now you should understand what is reproductive health. So you know that in the body there will be growth always. So growth is different up to 12 years of age. Teeth fall, body size, height, weight increases. That is one part of the growth. But after 12 years of age, once you attain the adolescence period or the puberty, then the reproductive growth starts, right? Secondary sexual characters develop, the body increases in size. This growth is separate. Then you can say that the body has attained the reproductive maturity. The body is capable of bearing a child. That means the female body is capable of reproducing. But But then during this period, you start feeling insecure and you easily get inspired by others' ideas. So suppose if your friends force you to do any unwanted activities which are not good at this age, you must not get inspired and go to do such activities. It is not that your body is ready for reproduction, you can do any sexual activities or you can bear the child. Mental maturity, your mind also needs to be ready. See, for example, once people get married, the people in the house, the elders force them to bear a child. But then if they continuously keep bearing the child, the population increases, and then the government what advises to the people to maintain one single child or two children ratio. So in this confusion, people are confused what to choose. Should we bear the children under the influence of elders, or should we minimize the amount of children under the advice of government? Because since the population of the India is increasing, the demand for food and other things are also increasing, right? And then reproductive health involves the preventing the chance of sexually transmitted diseases. So, reproductive health means here sexual intercourse. In sexual intercourse, it is a very intimate thing. The bodies come very near to each other. So, in this type of thing, there is much chance of acquiring infections, right? When the bodies come so near in this act of sexual intercourse, there will be transmission of diseases such as gonorrhea and syphilis. Gonorrhea and syphilis are bacterial diseases which are sexually transmitted. They are bacterial infections which are sexually transmitted. Gonorrhea and syphilis. Whereas human immunodeficiency virus, AIDS, acquired immunodeficiency syndrome, HIV and AIDS, these are viral diseases which are also transmitted sexually. So once we go into this act of sexual intercourse, there is very much important that we need to get our bodies prevented from such diseases. Here arises the word called contraception. Contraception is nothing but preventing the bodies from getting sexually transmitted diseases, as well as preventing unwanted pregnancies. You cannot always bear the child. It is not that your body is ready so that you have to bear the child. Your mind also needs to be ready. So here rises the topic of contraception. Contraception means it is done to prevent unwanted pregnancies, and also it is done to prevent sexually transmitted diseases. Because in the act of sexual intercourse, when bodies come near, there are much chances of developing, contacting sexually transmitted diseases. So that is the reason you should not have multiple sexual partners. If you have multiple sexual partners, there are more chances of getting sexually transmitted diseases. So contraceptives means, I told you, right, to prevent unwanted pregnancies and to prevent the transmission of sexually transmitted diseases, we use contraceptions. So here reproductive health involves preventing the chances of sexually transmitted diseases, STDs, and preventing the unwanted children. And it means a married couple should be able to enjoy the reproductive phase of life without having the burden of children in the mind. The reproductive phase of life should be enjoyed happily. And the act of sex has the potential of fertilization. That means whenever there is an act of sex, there is a chance of pregnancy. So here arises the topic, here arises the contraception, right? So potential of creating many sexually transmitted diseases. So act of fertilization, act of sex has the potential of pregnancy and fertilization. So and it has also the potential to create sexually transmitted diseases, STDs. So how contraception is important here. So what are the methods of contraception available in the market as of now? There are two methods of contraception which can be classified as surgical and non-surgical methods of contraception. Surgical method of contraception in males involves vasectomy. The male reproductive system has vast difference, right? It carries the sperms. Then what here is done is vasectomy is the vas deferens tubule is cut off so that the sperms are not released. So this is a surgical procedure, vasectomy in males, to prevent unwanted pregnancies and sexually transmitted diseases. Then tubectomy is a surgical Tubectomy is the surgical contraceptive method in females where the fallopian tubules will be cut so that the ovaries or ovum is not released and then it is not fertilized. So that in tubectomy, if the fallopian tubules are cut, the ovum will not be released into the uterus, right? So thereby unwanted pregnancies can be prevented. And what are the non-surgical methods of contraception? There is something called condoms which are both available for males as well as the females. So this is nothing but it is an outer covering for the penis. Thereby, due to this outer covering, sexually transmitted diseases and unwanted pregnancies can be prevented. And pills. Pills are nothing but drugs or the medicines which has to be taken orally by the mouth. These alter the hormones. These affect the hormones so that the menstruation cycle is altered. But then these also have side effects on the health. There may be weight gain, there may be hormonal imbalance and all these things. And there is something called loop or puberty. Here a device will be inserted into the female reproductive system which doesn't allow the fertilization to be done. So suppose if somebody is pregnant and they have went and determined the sex ratio, the fetus ratio, and suppose if they have found out that the sex of the fetus is female and they do not want a female child, then what they do? Surgically they go and remove the uterus. So thereby that is causing female feticide, killing of the female fetus baby. So this is increasing nowadays in India very much, female feticide. Female feticide affects the child sex ratio in India. Always the child sex ratios should be balanced between the male and the female child. Because the people are killing the female fetuses, the child sex ratio is being affected. The males are becoming more and the females are becoming less. So that is the reason government has banned the determination of fetus. The determination of sex of the fetus is a crime now in India. No hospital allows the determination of the sex of the fetus and nobody will tell you what sex is the fetus, whether it is a male or a female. So female feticide is a major concern as of now in India, right? So every surgical or non-surgical method may have some side effects, but it is not that people are not following it. And then population is also increasing nowadays. So to control the population also contraceptions come into account, right? Because the population is increasing, the demand for the food, demand for the home, demand for everything, hotels, homes, everything, land demand is increasing. So that is the reason to control contraception is important to decrease the number of children production. So that is all about reproductive health. And you have to take proper diet also to maintain. In your teenage, if you eat properly, a nutritious diet, then you will get a good reproductive health. And people should only bear the children when the mind is also ready to handle all the responsibilities of child, like food of the child, clothing, education, all these things. It is not that the body is ready so that we can get immediately, we can bear children. The mind also needs to be ready. Money is important, food is important, providing good education to the child, everything is important. So when we are ready to take all these responsibilities, then only we have to bear the children. So that is all about the reproductive health. And hereby we end the chapter of do organisms reproduce.